Hello and welcome everyone. My name is Sohaib Wadeea. I am a Arch 402 student. In today's assignment, I will talk about emergency department in hospitals. Let's start. First of all, I will talk about what's the emergency care, what's the point of it, and how we understand it in a better way.
Every day around the world, millions of people need emergency care. People seek care for infections and injuries, heart attacks and strokes, asthma or complications during pregnancy. Using specific protocols, they identify the destination hospital that can best provide the needed care. During transport, the patient's condition is continuously monitored and interventions are performed. Ambulances always need at least 2 personnel, one to monitor and manage the patient during transport and another to drive. An ambulance personnel should be able to communicate with the hospital prior to arrival if needed. At the hospital during handover, the ambulance provider quickly gives critical information to hospital personnel. As patients arrive, they are triaged to different areas to ensure that life-threatening conditions are recognized and that all patients receive the care they need when they need it. Triage is done by assigning patients to categories based on acuity of their conditions. Some patients need to be seen immediately, while other patients may safely wait. Trained personnel use clear protocols and specific equipment to assess and manage patients. After initial care is provided in the emergency unit, patients might be admitted to other hospital units for further inpatient care, transferred to another facility, or discharged home after treatment. An effective emergency care system needs laws and regulations, protocols to guide hospital personnel, certifications to ensure compliance with standards, and processes for accreditation of the quality and safety of the services provided.
Hospital planning emergency departments. Hospital emergency department is the first point of entry into a healthcare system for many people. This is especially true for those with non-acute illness. The decision to seek care at an emergency room instead of to a doctor's office can be based on a number of factors, all of which can contribute to overcrowding and increased wait times and result in less patient and staff satisfaction. And here we will talk about improving efficiency and revenue through a smart emergency department design, and that's what my main topic was about. Wayfinding. Clear paths of movement in an emergency department are essential to the staff efficiency and patients and visitor safety and flow. By that, what does it mean? When we go to the hospital, usually we get lost because it's really hard to find the right access or what we are looking for. And that's why we need to focus on making the emergency design very clear and very easy to find for patients. So in this way, they will have less issues for the staff as well. And that can be done by many different ways, by signs, by colors, by providing special landmarks and all of these access things for the patients. Second, we're going to talk about waiting area features. Here we need to properly organize our patients by having a specific area for the patient risk. For example, if a patient have a very risky situation, he will be in first, and the patient with less risky situation will be in second. Because if it's not organized, it's going to be overcrowded, and the hospital will not going to be able to focus on the critical stages of the patients, the most important ones. Next, we're going to talk about improved room design. By that is going to be a very important thing, because at the end, the customer or the patient needs to have a privacy, but as well as providing it can have a lot of area. So we need to be able to design a way where we have a privacy area for each patient, even if we gather them up. So in this way, the staff can do their job in the same space for multiple patients, which is really important. Improve the staff scaling. This is the most important thing, and the design can affect, for example, When the emergency department is more linear in design, staff can be assigned easily, which will help them in the staff issues. But if the design is irregular or have some kind of complicated design, this will make the staff work much harder. Next, we're going to talk about improved staff efficiency. Smart, lean healthcare architectural design can help improve emergency department staff efficiency by creating spaces that they are fixable, not complicated, easy to move, and it's easy to have all the patients in, let's say, in one space. This will make it less risky for the staff and less risky for the patients to have the best care as possible. Emergency department designed to improve safety. First, designed to protect patients. This is very important because if the design is not good, the patients will be able to see the fast phase of the emergency. A lot of people coming in, coming out, staff running, staff moving. So this will make them stressful. So in a way of design that we need to isolate them or have a different area for these patients so they will not get stressed out, which is not good for the patients at all. That's why we need to protect them. Designed to reduce active and make less staff errors. This is very important because if we design it in a different way or in a very complicated way, the staff will have issues to be as fast as possible to save as many people as possible. And as an architect, we need to think about in a way to make the life easier for the staff and the patient. Designed to improve the mental health care. This is really important and something that most of the hospitals don't have, but they should do, because in the last few years this issue has increased, which is the people with drug abuse or they have mental health. So we need to think about a way to design a private area for these patients, especially because they need a private care and they should not be in the same place as public for many different reasons and risky reasons as well. So it's really important to make the mental health care area in the emergency section for these special cases. Now we're going to talk about emergency planning in the hospital. For an architect, we need to create a very easy way or a very accessible way. Here we can see in this small diagram, we can understand that the emergency department is really connected to the most of the units and it's open on a different way. So this is the main point. So we need to provide a healing environment, a different access for it, and we need to think about all the points that I talked about previously. Also, now we're going to talk about a very technical way, which is they call it a rule of thumb, which is can be provided that having the emergency with a lot of access. So it can have a public entrance, and as we can see in this picture, that it's connected from all the units. In this way, it will make the staff work faster and much easier and less stressful for the patient, as we talked previously. As we can see here, the ambulance will drop the patients, and then the area will have a public access. So it's like it's not connected to the main hall, to the main entrance. So it should be completely isolated, completely different access. Here is a very important topic and a very important note that every designer should think about. As an emergency department, when the patients leave the emergency department, they need to go to the imaging, it should be very close for the patient. In this way, it will make their access faster for them and for the staff. So we should have the lab and the imaging so close to the emergency department, as well as close in a way to the main hall. In this way, we will have access from two ways, as well as the patients will have a faster access, and instead of moving so much if they have a risky situation. So in this way, they will have a faster pace and less risky movement. So it should be so close to each other. And now we're going to talk about one of the most important notes, in my opinion, which is the patient room. And this can be designed in a way where we have a different areas. One family zone, patient zone, and the caregiver zone, which means in every treatment we should have these three units connected to each other. It doesn't matter if we have multiple patients in one room, we should think about these three nodes, and they should be there for the best and the highest quality care for each patient.